Hey everyone, this is Dr. Jump. This is video 3 in which I'm describing one tip from my 25 hints and tips for learning anatomy that you can get on my website anatomyonthego.com. So feel free to head over there, enter in an email, and I'll send those tips for you free of charge, of course. So in this particular video, I'm describing tip number 18, which is use your own body like a cheat sheet and think like the body does. So let me explain a little further here. So we have this whole idea of surface anatomy. There are so many structures that you can actually feel, i.e. palpate through your skin. So this isn't an all-encompassing list here, but you can feel bones. For example, you can feel the scapula, the ulna, etc. You can feel the muscles, i.e. the quads and the hamstrings. The quads are the muscles of the front of the thigh, hamstrings, the muscles on the back of your thigh, among other muscles, of course. You can feel many muscles. You can feel blood vessels, for example, the radial artery near your wrist, the carotid artery in your neck. So you can actually observe these various structures. In the case of muscles, you can actually look at them and observe their actions. So if you know where they are and you can look at them and observe them and use them, it's not so much memorizing various things, but actually just understanding what they're doing and then observing them. And then if you know various terms, you know the language of anatomy pretty well, then it all just kind of corresponds and fits together pretty well. So on this slide, on the left we have the scapula, which is the shoulder blade. On the right is the ulna, which is the medial bone of the forearm. So you can actually palpate the two structures indicated by arrows there. On the left is the coracoid process on the scapula. So on yourselves you can actually palpate this or feel this through your skin. So if you extend your shoulder and then feel in the front, just beneath your shoulder joint, you can actually feel the coracoid process. And then just note that one head of the biceps brachii attaches at the coracoid process, and you can confirm just via contraction or movement of that muscle. You can feel the tendon moving around the coracoid process or as it attaches to it. On the right, what's highlighted is the olecranon process. This is the funny-looking, bulky head of the top of the ulna, or the proximal part of the ulna. So if you bend your elbow right now and then point your elbow away from you, you're pointing away from you the olecranon process. And then go ahead with your other hand that you haven't bent your elbow. You can just sort of feel through your skin that olecranon process there. Two key examples of surface anatomy. So then we have this thing called the Anatomic Snuff Box, and I'll let you use the internet to investigate the name of this a little bit further. But go ahead and try this with me. You make a thumbs up. You can have a fist or your fingers fully extended. Either one is fine. And then you find the small depression between the tendons, basically at the junction between the wrist and the hand. So note here that extension helps draw the thumb away from the palm, and abduction helps us make this thumbs up movement. And so this depression is actually created by three separate tendons as they attach to the thumb. So the key word here is pollicis. Pollicis refers to the thumb. So you can actually see these tendons, and if you know what extension is and abduction is, and also that you know that longus refers to a longer muscle and brevis refers to a shorter muscle, then this kind of helps you have some clues to figure out which tendons are which. And so you can actually look at your body, you can look at this depression, you can feel these tendons and put it all together to find what these tendons are and what their actions are. Other examples, you can feel the Palmaris Longus. You can actually see this muscle as it runs into the palm. So the name of the muscle is telling you what it's doing, where it's going, that it's a long muscle. Now note that some of you actually don't even have this muscle in your body. But if you fully extend your fingers and your wrist and then sort of make a half clench fist, then you can actually see this tendon pop up in your forearm. So I'll let you go ahead and try that and see if that tendon pops up for you. Then we could talk about the anterior forearm and the posterior forearm. If you know the actions, what the actions mean, for example, flexion is bending the wrist toward the forearm or bending the fingers, and then extension is straightening the wrist or straightening out the fingers, then basically you can just look at your forearm. Anterior is on the same side as the palm. Posterior is on the same side, opposite the palm or the dorsum of the hand. Then you can basically just look at these muscles and describe their actions given the definition of the terms here. So also think of muscles, if you would, like pulleys or ropes. If they shorten, they're actually going to pull on a bone in a very logical way. For example, the quadricep muscle is highlighted by the blue arrow there. And then we have a structure called the patellar ligament highlighted by the red arrow. So if this muscle acts like a pulley or a rope, it's going to fully extend our knee, and that's the action of the quadriceps muscles. Whereas a muscle on the other side of the thigh is actually going to flex the knee, draw the leg toward the thigh. So basically, you know where it is, and you assume it acts like a rope or a pulley. Then the action of the muscle just kind of makes logical sense. And you can actually just see this on yourselves right now. If you contract or use that muscle on the anterior thigh, then you can see that it will extend the knee logically. Two other muscles I'll highlight here. The sternocleidomastoid is the upper blue arrow. Just call that SCM for short. And then the lower blue arrow is the rectus abdominis. So on yourselves, you can actually find the SCM, and when it contracts like a pulley or a rope, it's going to pull your head to one side and also rotate your head. Whereas this rectus abdominis, which is the six-pack muscle, if it contracts like a pulley or a rope, it's going to pull your torso towards your thighs or towards your lower extremity. So basically, its location, think of it shortening like a rope. It's going to just kind of tell you what it's doing, what its purpose is. So the recap and takeaway here is the answers to anatomy are literally on you. You can actually see them, which is nice. And can you really think of another subject quite like this? And so I would encourage you to use this to your advantage, to look at your bodies, to actually observe the muscles and their actions, to try to feel and palpate as many structures as you can through your skin. And so if you need these 25 hints and tips, feel free to find me at anatomyonthego.com. I'll send you the PDF. Feel free to interact with me on Facebook or on my website, whatever works best for you. Happy to help. Love this stuff. I think it's fascinating, and I love interacting with students. So hopefully this video gives you a few hints and tips to help you out, and I will talk to you later. Bye.